Thank you, Matt. So our next session, we have a roundtable discussion with our international leadership to discuss the topics from the conference today and how we see these as being relevant in each of our UPMC international markets. So first, I'd like to introduce Scott Stevens. Scott is the Vice President and CIO of UPMC International and UPMC Home and Cancer Center. Also on the panel today will be Jeffrey Bernstein. He's the Senior Vice President of UPMC International and our Managing Director of UPMC in China. Eamon Fitzgerald, who is our Vice President of Health Services in UPMC in Ireland. Dr. Giovanni Vizzini, he's the Chief Operating Officer at UPMC in Italy. And Dr. Andrew Watson and Dr. Matthew Harrency, who are the course directors and who we've been introduced to already. So Scott, I'll hand it over to you and look forward to a very interesting conversation here.
Thank you, Mike, and thank you to all the speakers throughout the day. It's been a tremendous amount of expertise and experiences that have been shared. We've heard real world experience from healthcare providers, from payers, from product and service providers, as well as implications to patient access, technology infrastructure, cybersecurity, legal, and many, many others. This panel is really exciting. It's truly a unique opportunity to hear a global perspective. We're live broadcasting really across the globe from the US, Ireland, Italy, and China. So it's a great opportunity to hear right from locations all the way across the globe. Today, one of the common themes we've heard throughout the day is how the coronavirus pandemic forced a seemingly overnight transformation in healthcare delivery and its ancillary businesses. And I wanted to start with Dr. Watson. From your perspective, what was the single most important lesson learned about patient care during times of such uncertainty?
It worked. And it's incredible how much we use telemedicine, where almost the entire healthcare system went on to telemedicine. And I've been in the field for about 15 years, and there's been a lot of dragging and trying to figure out policies, procedures, regulations, but it works and it's safe and it can provide high quality care. And that's what's just so tremendously exciting about it, is that we were forced to realize how powerful of a tool this is. In surgery, we had the trilaparoscopy. It took us almost a decade and a half to fully adopt it. In telemedicine, we had about 2 weeks or a month and a half. So the fact that it works and it can provide safe care is absolutely extraordinary. And it gives me real promise and excitement about what we can do with this globally within UPMC and also beyond. It's a great question.
Eamon, what about in Ireland? What's your perspective from the country of Ireland?
So a number of points that I'd make, Scott. I think it's really important to identify early in times of uncertainty the controllables and control the controllables, and to share the sandbox learning with engagement of multi-stakeholders, and the imperative investment in enabling tools to survive and thrive in terms of IT infrastructure, applications, business intelligence, clinical intelligence, cybersecurity, as referenced by our colleague earlier on, Chris Carmody, and also ideation and innovation, because we're in a constant cycle of learning and iteration. And I guess the paradigm of health technology and innovation and UPMC being at the forefront of that as a not-for-profit can attract in times of crisis and uncertainty an openness to engage and to partner and to really put the patient at the center of our mission and values, both locally, regionally, nationally, and internationally.
Dr. Harrency, what do you feel is the single most important lesson learned from a global perspective?
I would actually, unfortunately, I'm going to tag on to Dr. Watson and agree with Dr. Watson, is that it works. And so I think, I'll extrapolate that to a little bit of a larger lesson, which is really just how we can take better care of our patients. I can speak as a cardiologist. We have a tough time, figuring out how do we get patients who have transportation issues, who need to come back for follow-up in just a couple of weeks, and it's difficult. There's cost involvement there as well. And so this is an opportunity. We've learned now how we can actually monitor the patients much more effectively and efficiently. Dr. Bart brought up during his talk today about, as a cardiologist, we talk a lot about, physical exam findings and whether the patient has swelling of the legs or edema. And even just, we have now all learned how to utilize the virtual visits more effectively. And so we can see that the patient can show us, physical exam findings, how much swelling they have, et cetera. So I think this really has allowed us to take better care of patients. And in particular, as we look at opportunities that we have globally and even in Italy, is to think about, other areas that may not have as good medical care or as close to medical care. And so we're areas where it's tougher to have physicians or as much access to physicians, places like nursing homes, long-term acute care facilities. We can now provide care virtually, from different locations throughout the country. And it really is an exciting opportunity. And I think one that, really was accelerated by what happened in 2020.
Yes, we heard a lot about the very rapid adoption of virtual technologies. And one of the items that Dr. Bart mentioned in his presentation was lots of things had to line up to make that happen. And one of them, as an example, in the US, Medicare, Medicaid reimbursement was made available for telemedicine visits with minimal requirements, and private payers quickly followed. What are the national response and other changes in policies related to telemedicine and virtual healthcare that have happened in other countries? And Jeff, I'll start with directing the question towards you in China.
Sure. Thanks, Scott. I think the point is that even before COVID, China had already, as part of its Healthy China 2030 plan, supported the growth of what we call internet hospitals. And because the public system in China is predominant in terms of healthcare delivery and insurance, the government's decision to promote telemedicine meant that, the government health insurance would also cover it. So we actually went into the COVID period with a tremendous amount of momentum. I would say, the interesting thing, first of all, it's important to understand the user base of smartphones. So China in 2019 already had 850 million smartphone users. We have 971 million today. And by next year, we'll be over 1 billion smartphone users. And so once you have that, and as Ellen mentioned, the digital gap, which in China actually doesn't exist like it seems to in parts of the US. So actually the other thing the Chinese government did is to make sure if you've got 900 million cell phone users, you need to have an affordable broadband access for these people. So they actually use the phones so that, that you can do things like telemedicine. So I think the overall lesson is that, the Chinese government already kind of saw into the future and had the tools available to it to promote telemedicine. And the problem that they're trying to solve is actually a huge crunch on the academic medical centers in China, because essentially the whole public wants to go to these top hospitals. And using telemedicine, as Dr. Watson mentioned, is a way to more effectively allocate resources and efficiently provide care. And so where we're ending up, just to complete that, is that what we're seeing is a shift from what were pure internet plays in telemedicine to now the old brick and mortar hospitals have all implemented telemedicine platforms and essentially creating a hybrid form of care, which seems to be, what will be the future in China.
Interesting. And Eamon, how about Ireland? What was the government response in Ireland?
Yeah, so the government has a blueprint for the Irish Health Services over the next 10 years, which was agreed on an all-party basis about 4 years ago, called Sláinte Care. And it is about patients receiving the right care in the right place at the right time. And there's been an acceleration of the adoption of virtual and telemedicine as a result of the COVID crisis. But it, just like Jeff is saying in China, it predated that crisis, but it certainly has acted as an accelerant. And it's about bringing care to patients rather than patients having to travel to care, so improving access. It's also about improving the prevention by providing people with opportunities to engage as partners in their care through physiological monitoring and through feedback with patients having chronic conditions. And also in terms of models of care where the payers have come on board, interestingly enough, and enabled in the area of mental health to have patients who would historically have had to have been inpatients to receive their care, to receive care in the home or other appropriate locations. And St. Patrick's Mental Health Services in Ireland has been at the forefront of leading out on the provision of mental health services in environments other than in inpatient care, unless it's a clinical imperative for that to happen. So it's opening up access, it's opening up the improvement in prevention, and it's also opening up the ability to have partners more proactively engaged, the payers, the providers, and ultimately the patients as very active participants in architectures of their care and their outcomes to care.
Dr. Vizzini, Italy was hit particularly hard at certain points throughout the pandemic. What sorts of national efforts took place to help out with the population in Italy? You're on mute.
Sorry.
There you go.
I would say that there have been a major revolutionary change, actually, because Italian health system started from almost, I would say, almost zero use of telemedicine. And very recently, the Italian Observatory of Digital Innovation from the University of Milano showed that more than 50% of family doctors carried out their activities remotely. And they also found that 2 or 3 of them found better performance in clinical practice in terms of response time to patient, more effective information sharing, and so on. And today, more than 50% of doctors believe that the digital revolution is going to increase their efficiency, effectiveness, because they feel an engagement from the patient that is increasing. They can offer personalized care, and it's a very important also a reduction of clinical error. And the governments probably was even more revolutionary, because at the beginning of the pandemic, the Italian National Institute of Health launched the official indication for telemedicine assistance service, so including minimum technology and organizational requirements, but also the national system for the first time approved the reimbursement of the telemedicine activity for the public health system. So this was the open door for the use of telemedicine in public health system. So I think that the two change cultural from the doctor perspective, and I suppose also from the patient's perspective, and the endorsement of the governments and the philosophy of our politicians has been the major change during the pandemic.
We heard a lot of compelling data today. It was very interesting to see Dr. Bart shared a chart showing that where we had originally averaged 200 televisit pre-pandemic to hit a peak of 10,000, and now we're averaging a sustained 4,000 daily. Deanna shared data from Avera showing that there were significant improvements realized to adverse drug events, there were improvements to unplanned senior care transfers, there were lives saved in the ICUs, reduction in cost. And Dave shared from ID Connect data showing decrease in antibiotic use, increase in orals versus IV, and pharmacist efficiency. How do you feel that virtual care can continue to support these and other quality of care measures after the pandemic? And in what form do you feel will be most impactful, the sorts of virtual care technology or solutions that we've been talking about today? Eamon, what are your thoughts? Oh, you're on mute.
If we can integrate, we can achieve much more than if we're fractured. And I think the way we achieve the impact of quality of care at scale is through integration. And it's not just technological integration, but it's also, I suppose, the integration of work-life balance for people, enabling people to be able to use the time that they have available more productively and effectively and efficiently, so that it's patient-facing time, and try and lean out processes that don't add as much value to direct or indirect patient care. So in terms of telemedicine and what's been talked about in terms of the technology deployed for infection prevention and control, safety and efficacy of care will be assisted by harmonization and by consistency of approach. As an example, in Ireland, we've not alone had the COVID challenge, but we also had the cyber attack layered upon that. So we had an issue where patients were not getting access to care in a way that they might ordinarily because of those two phenomena. And UPMC Hillman Cancer Centre was able to step up to the plate with the bonds and Cork University Hospital and the HSE and provide access, deploying virtual technologies and virtual planning to hundreds of patients who otherwise would have had their cancer care interrupted. So I think that's a prime example of virtuality of care and harmonization of care in order to promote quality and efficacy of care at scale.
Jeff, do you have anything to add from China, and what sorts of technology you're seeing is going to stick and be impactful towards quality of care initiatives?
Yeah, I'd like to make two very specific comments. One is I completely agree with Eamon. And, what we've found is through, MDT and tumor board discussions that we've done in China, once you go to virtual collaboration, you can easily bring in international physicians. And I think that's the wave of the future. UPMC will be able to more easily get involved in patient care with these technologies. And the second point I'd make is that, with the explosion of wearable devices and other items that are providing data, I think that's the next wave too. We've been talking to researchers in China who, for instance, for sleep medicine, have new wearable solutions, and that'll just create new opportunities in terms of more data and more efficient care. So it's exciting to see what's coming.
Great, thank you, Jeff. To keep on time, I'm going to get the last question out there real quick, and that is obviously the consensus among the conference today is that virtual care is here to stay and is a major offering and expectation of patients. There's significant investments being made across the industry and a lot of changes from government regulatory that are paving the way to help these rapidly scale. What changes in practice do you see physicians need to embrace in order to meet these demands while advancing and improving care being delivered to their patients? And direct that towards Dr. Harrency.
Yeah, so I think one of the things that is really important for physicians is to be able to balance the in-person care with virtual care. So one of the things that we've seen is we went in, the early stages of the pandemic very quickly to an all virtual model. Now, as we've come out of it, is how do we incorporate virtual care into our daily workflow? Because if you have a patient who you're seeing in the clinic and then you have to run back to your computer and then go see a patient virtually, and then you got to run back again, you might be doing a procedure and then you got to run and see a patient. It's not necessarily the most efficient use of your time. So I think is really balancing your schedule and trying to incorporate this as really a key component of your work. And so that might be having, all virtual, clinics, that might be having, all in-person clinics, morning, afternoon, however that would work for you. But I think that that's really a key component to this being productive. because now there's new opportunities. We're going to be able to see patients in, different states, let alone in different countries. And so how do we make sure that we have the right time and the right workflow that makes it most efficient for physicians and providers?
Dr. Vizzini, final words on impact to physician practice. What are your final thoughts on that?
I agree with Matthew that time management is a crucial problem, but I think that we need to include telemedicine training in the university. We need to train young people to use this methodology since the beginning, because obviously it's changed also the way that the physician learn medicine, how to treat a patient, a different methodology, different approach, something really new that we all expert doctors have learned with experience in years, 20 years of practice with a lot of mistake, obviously. We need to include in the training of the young doctors the telemedicine function and approach.
Well, thank you to the panel. And that concludes the virtual care roundtable discussion. Thank you for everyone's time.
Bye.
I'd like to echo that, and thank you to everyone on the panel. I'm just going to hand it over to Dr. Harrenstein and Dr. Watson for any closing remarks. Thank you, everyone.